Do you have unipolar depression, or could it be a case of bipolar disorder? In this video, I'll discuss some differences between these two conditions. I'll also talk about 3 signs indicating you may have bipolar disorder. Bipolar disorder is one of several mood disorders. It can present with a loss of sense of control and also great distress. Bipolar disorder can affect you so severely that it impairs several aspects of your life, including work, school, and relationships. Bipolar disorder can initially present as depression, mania, or hypomania. What this means is that you may initially be diagnosed with depression and treated as such for many years before you develop a manic or hypomanic episode. Suppose you end up developing mania or hypomania. In that case, your doctor will likely change your diagnosis from Major Depressive Disorder, also known as Unipolar Depression, to Bipolar Disorder. This infers that your treatment may also change depending on which medications you have been taking. Note that with bipolar disorder, people may develop a manic or hypomanic episode first, with depression coming later. It is also important to know that bipolar disorder is a spectrum. There are 2 types, bipolar I and bipolar II. Bipolar I disorder occurs when you have a manic episode. Bipolar II disorder occurs when you have a hypomanic episode. Hypomania tends to be less severe than mania. It is for this reason that hypomanic episodes can sometimes pass by without being noticed. Hypomanic episodes are less severe, sometimes shorter, and may not cause marked impairment. This means you could have a hypomanic episode and consider this normal, as you feel energetic, upbeat, and active, especially if you were previously feeling depressed. This could make it seem like you only had depressive episodes with periods of normalcy, which were actually hypomanic episodes. I'll discuss mania and hypomania in more detail in a later video. If you currently have depression, there are some signs you may actually have bipolar disorder, even if your doctors have not diagnosed you with bipolar disorder. This is important because even though there may be a crossover in medications used for both, there is a difference in treatment. Before I proceed to talk about the signs that indicate you may have bipolar disorder instead of depression, let's talk about the symptoms of bipolar disorder. I discussed the symptoms of depression in a previous video, so I'll focus on manic symptoms. According to the DSM-5, a manic episode is a period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased goal-directed activity or energy, lasting at least 1 week and present most of the day, nearly every day. If you end up being admitted to a hospital due to these symptoms, it is also considered a manic episode, even if your symptoms have not lasted a week. Also, during the period of elevated mood, increased energy, and activity, you must have at least 3 of the following 7 symptoms. Inflated self-esteem or feeling grandiose. You may feel abnormally upbeat, jumpy, or even wired. Decreased need for sleep. You may feel well rested after only 3 hours of sleep. More talkative than usual. Racing thoughts. Feeling very distracted. Increased activity, energy, or agitation. This can cause you to work longer hours, feel hypersexual, or become more social and interactive. Excessive involvement in activities that have a high potential for painful consequences. This can lead to poor decision making. Examples include excessive spending, taking sexual risks, and making foolish business investments. According to the DSM-5, these symptoms are present to a significant degree and can cause a noticeable change from your usual behavior. So in many cases, family members and friends will likely observe and point out that you are different from your baseline. Also, rather than just 3 of the above symptoms, you need 4 of these symptoms if your mood is only irritable. To be diagnosed with bipolar disorder, you must have had an episode of mania or hypomania. In some cases, hypomanic episodes can be missed as they're not as severe as manic episodes. You may consider a hypomanic episode normal, especially if you've been feeling depressed for some time. So because you don't realize your elevated mood, energy, and activity level was a hypomanic episode, you may not describe it to your doctor as such. This is because you thought you had depression with periods of normalcy. As a result, you may continue to receive treatment for depression. So if you have a diagnosis of depression, but you're not sure if it could be bipolar disorder, you should consult your doctor. However, here are 3 signs that you could potentially have bipolar disorder. 1, you have a family history of bipolar disorder. This is much more significant if the family member with bipolar disorder is a first-degree relative, such as a child or parent. This infers that there is a genetic component to bipolar disorder, which means it can be inherited. 2, your depression does not improve with antidepressant medications. In some cases, your depression may even worsen with antidepressants. Note though that rather than bipolar disorder, this could also be a case of treatment-resistant depression, which means you have tried 2 or more antidepressants at proper doses without any response. 3, you recover fully after taking a mood stabilizer for a month. Now, there are different types of mood stabilizers, and what makes this tricky is that some of these mood stabilizers can be used to treat both unipolar depression and bipolar disorder. When we treat depression but don't get an adequate response with just antidepressants, we can add mood stabilizers to help resolve the symptoms. Examples of such mood stabilizers include Seroquel XR, Rexulti, Abilify, and Rela. So it is possible your depression may be bipolar disorder if you have a family history of bipolar disorder, if your depression does not respond to antidepressants, or if you recover fully from taking a mood stabilizer for a month. Please note though that these are only possibilities and not absolutes. It does not always mean your depression is bipolar disorder if you have a family history of bipolar disorder. It does not always mean your depression is bipolar disorder if you do not respond to antidepressants. It may well be that your depression is treatment resistant. It also does not always mean your depression is bipolar disorder if you recover fully after taking a mood stabilizer. My recommendation is that you have a conversation with your doctor if you're still struggling with your depression or if you feel you may have bipolar disorder. If you're diagnosed with bipolar disorder, your doctor may consider adjusting your medications. This will likely include adding a mood stabilizer to your regimen. I'll discuss the treatment of bipolar disorder in a future video. Don't forget to share if you think others will find this helpful. Thanks for watching.